should be sharing my screen right now. All right. So when we were talking 2 weeks, sorry, not last, but 2 weeks ago, we were able to talk about the first two bullet points, which was explain the concept of the self in the late stage of Alzheimer's disease and describing those effective ways to communicate and also connect with someone in the late stages. Now today, what we're really going to be focusing on, right, we're going to list those late stage care options, and then we're also going to describe how we're going to access and evaluate them as well. Right, and I'm sure also from PSS side and also from the Alzheimer's Association side, right, we do provide those services to help also further after today's program to really help access those different care options. So of course, feel free to reach out to either if you do have any questions after the program. Great, so we're actually going to start off with a quick video. So we're going to start off by hearing from Stephanie, right, who has provided that care at home for her mother with Alzheimer's disease. So here we go.
Our entire family, me, my brother, my sister, my dad, we have no regrets. We know that we did everything possible. If there was anything else we could have done for my mom, we didn't know about it, and no doctor knew to tell us about it. We did everything we could to provide my mother with comfort and peace through this very difficult disease, because that's what she did for us when she was children, raising our family, when we were children and she was raising us. That's what she did for us. So we felt we owed her that.
So yes, just like how Stephanie talked about, right? So her siblings, right, they really had no regrets about the care that they provided, right? Because they knew that, they did everything that they could to really best help their mom, right? And the goal was to really provide that comfort and peace throughout all stages of the disease, right? And really providing care, that was really an opportunity, right, to give back what their mother gave to them while they're growing up, right? And I think that just really hits home, especially for a lot of us who might be going through this journey, right? So when we're talking about options for care, right? So more than half of people with Alzheimer's disease, right, they are cared for at home, even the late stages, right? And most of that home care is probably provided by friends, family, right? But there are also other options to really consider, right? When we think about other options, we want to consider maybe a paid care aid, right? Or maybe visiting doctors and nurses, right? Respite care that might also be offered through, especially with local facilities as well, right? And when we're thinking about the person with dementia, right, they will need somebody nearby at all times in the late stages, right? Regardless of the time of day, right? I know some caregivers say like it is a 24/7 job, right? Because again, sometimes there might be some behaviors that do arise during the nighttime, sometimes during daytime, morning time, anytime, right? And of course, there are many resources that's going to help assist the family in making sure that we are able to help provide that level of care, right? That contentment, the dignity, right? For that person living with Alzheimer's disease and any kind of care setting as well, right? So if the person is being cared for at home, right, they can all, of course, family and friends, they often can provide that assistance with caregiving. And we definitely want to make sure that we kind of really see what is going to be our support group for that, right? Great. All right. So other options for care, right, in senior living settings, right? We do have those senior living settings. Residents, they do have that ability to carry on as normal as a lifestyle that they wish, right, or are able to according to their abilities, right? And when they are in the earlier stages, so those people with dementia, right, they're able to go shopping, they're able to, have friends and family visit whenever they want, right? Maybe they go for walks, they go to their favorite restaurants, go to a park, right? But in these later stages now, right, the person with dementia, they might move to another level of care, right? And again, that same or another setting, right? And of course, those types of senior livings, those options might vary, but of course, all of them can provide those dignified ways of really dealing with, right, not being able to live independently, right? So we're going to go ahead and take a look at some of the few types of senior care livings, right? For example, oops, sorry. Continuing care retirement communities and companion care services, right? So those continued care retirement communities, those typically provide those range of living arrangements, right? That includes independent apartments or freestanding homes, right? Through that assisted living and also nursing home care, right? Some of those, which also include memory care units as well, right? And that might be one of the options that we really want to explore, right? Does this place have a memory care unit, right? And those settings, those often do offer those advantages of allowing the individual, right, to really move in and out of those more intensive settings as those needs change, while they are still able to provide that easy access, right, to other people, to services within that retirement community, right? Sometimes we do have personal care aides or companions, right? Home care services, right? That might be brought in at an additional cost. And most do offer that range of that communal dining options also to choose from as well, right? Some nursing home services within continuing care retirement communities, right? That might include memory care units, but of course, right, the specific services are going to be provided on these units do tend to vary. So we do want to be sure that, again, we're going to ask about what sorts of behaviors, what sorts of issues can and cannot be handled in those units prior to initiating that move, right? We want to make sure that we kind of keep these all things in check, right? So that we avoid having to move the person again if those issues escalate, right? So we really want to explore what are those services in these options for care, right? All right. Next on our list, right, residential care homes, right, also known as board and care homes, right? Those are with a community group living arrangements for around 3 to 10 people living with dementia, right? That offers another option for care, right? And most residential care homes, those are licensed for 6 or fewer residents, right, housed in more of a private residential home setting, right? With each resident having a private space or a shared bedroom, right? They offer supervision 24 hours a day, and they also provide the assistance with personal care needs, right? And the cost of living in a residential home, that varies. So you really want to explore whether some do accept Medicaid payments while others do not. So again, we're going to explore those payment options as well. And of course, when we're talking about the quality of care and the quality of the homes, right, that can vary very greatly amongst those residential care homes too, right? So it's really important that we do take a visit, right? We do visit the home before we commit to that place, right? At different times of the day, right? That's just a quick tip, right? We want to be sure that we're really setting up this person living with dementia in the best possible care as possible. So really visit that residential home, right, different times of the day, and talk with other families who might be there, right, who have used the services if possible, so you get that firsthand advice, right? Great. And long-term care, right? So long-term care settings such as, memory care units or nursing homes, those might be considered by many families during the late stage, especially again when 24-hour care and or more intensive medical treatments when that might be required, right? So facilities with memory care units, that could also be a good option for long-term care residential care too, right? Again, making sure that we do our homework, right? That really does pay off, right? So really be sure, right? Maybe we take a look at the community resource finder, right? Which is going to list all those licensed care facilities, right? Making sure that we're able to really, again, look into these long-term care units at different times of day, getting some input, maybe even word of mouth, right? Others who might be taking care of someone, right, who has also used some of these long-term care facilities, right? It's better to also really, sometimes word of mouth can really be a really good thing, right? Because if someone has a good experience, right, that just heightens your chance of also having a good experience too, right? Versus, just willy-nilly, right? Um, Another option for conducting those searches, right, is also the nursing home compare, right? That's also accessible online at medicare.gov/NH compare. So let me go ahead and put that in the chat. I'll put that in the chat after the program. So medicare.gov/NH compare, right? Through that service, you're able to, within a radius of a zip code, right? You're able to see, right, rated based on those health inspections, staffing, right, and also quality measures too. Right, so I think that's a really great resource. Again, it also tells you if it does get covered by Medicare, Medicaid as well. So definitely make sure you use that one, right? Once some of those appropriate residential services have been identified, right? Again, it's a good idea to call for arrangements for visits, right? Again, that's going to give you a good picture of the quality of the residential care, and also going to give you a good satisfaction too. All right. Oh, yes. So many times there's that promise, right? I'll never put you in a nursing home, right? The promise to never place the person that you care for in a facility, right? I know that's done with very best intentions, right? And it is a concrete way of telling the person that, you are and you will continue to be there for them, right? Throughout the course of the disease. However, though, right, as the disease progresses, those care needs that arise, right, that could not have been foreseen, right, some of which also that requires a lot of physical strength or availability that you could not provide without considerable assistance, right, that's something to really consider, right? Other times, there are medical needs that arise that's going to require that intervention, right, by trained professionals or paraprofessionals. And of course, for those reasons, amongst others, sometimes that decision that's going to need to be made to move the person that you're caring for into facility, right? Despite having promised not to do that, right? And again, sometimes there is a stigma with nursing homes, right? But again, when you aren't able to take care of yourself, right? Again, you're not going to be able to take care of someone else 100%, right? And being able to have an open mind of a nursing home, right? That could also help, especially when, again, these care needs are going to be extravagant. No one person can meet all these needs by themselves, right? And it's also a peace of mind that there will be 24/7 security, right? There will be 24/7 assistance. There are going to be those medical professionals who can help this person specifically living with dementia, right? All right. So we're going to have Mary O'Hara, who is a social worker, and she's going to talk about discussing the realities of the promise that we just talked about.
Caregivers will often speak about how they are committed to not placing their loved one in a facility, that their loved one had expressed to them years ago or even recently that they did not want to be placed in a facility for whatever reason, for a number of reasons. And sometimes caregivers are faced with having to place their loved one in a facility because they cannot provide the care that the person needs at home. And while a number of people are able to be cared for at home for a very long time, there are cases where the family just cannot meet the person's needs, and it would be better for the person to be in a different setting where they had the care that they need. And this is a very difficult thing for a family member to accept, especially a family member who has made a promise to their loved one that they would never do that. And on top of the grieving that they're already experiencing and the loss that they're already experiencing,
it's so devastating for them to feel as though they let their loved one down by having to make this decision.
So it's just kind of like how Mary O'Hara just talked about, right? Some people living with dementia, they can be cared for in the home, but others cannot, especially due to their care needs, right? And this might be very hard for a family member to accept, right? Especially if they made that promise, right, not to place them in a care facility. And of course, some people, they might feel that they have let the person down by making a decision for placement. But of course, however, right, placements that might be an anticipated and expected part of the care plan, right? Great. So, even if your plan is to really keep that person with dementia at home, right, things can change and really making sure that and make that placement necessary, right? So some common triggers for long-term care placement, right, that can include, for example, an increase in the healthcare needs of the person, right, including the need for medical equipment, right, requiring those trained providers to really provide that medical assistance, right? Maybe it could be a change in the health of the family caregiver themselves, right? Maybe there's more hands-on care that's going to require more skill or strength, right? Beyond what the family member can provide, right? Maybe there's safety issues or maybe some behavioral issues that could not be resolved by just a different approach or medication change, right? Which might make that home care no longer possible, right? It's not always the case that a move is needed, but again, it is a good idea to just plan ahead for this possibility, right? Instead of potentially needing to choose a facility in a crisis situation, right? Long-term care facilities, they often do have waiting lists, right? So it can be very helpful to really start researching options earlier rather than later, right? And many families, they do find it reassuring to have a person's name on a waiting list, right? Knowing that they can pass, right? Or just simply decline if the facility does call, but you're not ready for it, right? And of course, with this kind of decision making, right, we want to try to involve those closest to the person, right? As with arranging care in the home, right, it's really helpful to find a neutral person to really run these meetings, right? And the goal is to give everyone involved, right, the opportunity to express thoughts without judgment. And it's really important to end meetings with a plan, right, such as maybe visiting at least 3 long-term care facilities before meeting again to choose one, right? All right. Facilitating a move. So sameness, routine, and also that predictability, right? Those are very helpful to someone, especially living with Alzheimer's disease, right, or another dementia, right? And that allows a person to function at the highest level possible, right? So making a needed move, right, that might be difficult for the person, but of course there are different ways of easing that transition, right? So when we are facilitating a move, right, there's going to be a lot of questions, right, that we're going to consider. For example, right, might think, like, what do I tell the person with Alzheimer's, right? How can I make it easier for all, right? And some tips for that, right, is again, we want to keep it brief and simple, right? When you tell the person about the move, right, the simple facts that might work best. So, for example, right, saying something like, it's not safe for you to live alone anymore, or maybe, you need more care than we can give you at home, right? Those could be some examples of keeping it brief and simple, right? Long explanations or trying to convince the person, right, only increases that resistance, right? It's usually best to tell the person only a few days in advance of the move as well. Acknowledging feelings, right? It's crucial to acknowledge whatever feelings the person expresses, right? Anger, sadness, right? Those are normal reactions to maybe an anticipation of a move. And maybe that is a reaction to the loss of independence, right? If the person expresses sadness or maybe they're crying, join them in sorrow, right? Allow your own tears, right? Give the person a hug, right? You don't need to do anything else, right? Really acknowledge them. If the person expresses anger, right, they're saying, I don't want to move, I want to stay in my own home, right? Again, acknowledge that feeling, right? Maybe by saying, I know you don't want to move, right? Or I know you wish you could stay in your own home, right? Even that acknowledgement that could help neutralize that anger, right? Because the person is going to feel understood, right? And then we're going to add, it's important that you are safe, right? Of course, it's difficult to listen to feelings of anger, especially if they seem to be directed at you, right? Want to remember again, though, that sadness and anger are normal and healthy responses, right? The more the person is able to express those feelings, right, the easier the adjustments will be to move, right? And providing that reassurance and that redirection to maybe a food, right, or an activity, that can be especially helpful too, right? It's really important to remain firm in your decision, even amongst those difficult emotions. Teaming up with family, friends, and or professionals, right? You can definitely team up with maybe a sibling, a spouse, other relative, friend, or maybe even more than one person to help make the move, right? It might be stressful for you to try doing that all by yourself, right? Seeking counseling if needed, right? Sometimes those challenges of caregiving that might trigger old feelings that we thought, were just dealt with a long time ago, right? If you have long-standing unresolved feelings of sadness, guilt, or anger, right, it really is helpful to seek counseling with a qualified mental health professional to really help you work through that difficult transition. Great. So in this next video, we're going to have Elizabeth Gold. She's going to talk about how to help a move take place smoothly.
When moving to a facility, there's ways in which you can make it easier for the person with dementia. There are things you can do to prepare ahead of time, and then there's things that you can do on the day of the move. One of the things you can do is talk with the staff ahead of time and let them know about the person, what they like, what they don't like, their routine, and the things that they enjoy doing, maybe favorite foods or things like that. It's just, if there's any way in which to bring the familiar in, it's going to help, and it's going to help make a difference. Along the same lines, you may want to ask if there's a way to set up the room in advance. So to bring in a favorite bedspread, or, the easy chair that they love to sit in, or pictures or photos, so that it's familiar and it's very helpful when orienting to a new environment to be able to see things that are yours and know, oh, this is my room. Other things you can do is think about on the day of, you may want to come at a time that is most convenient to the person and is not as disruptive to the daily routine. The time I tend to think about is maybe around lunch. You've had a chance to get up, have breakfast, get ready for the day, and then that may be a logical time to come. And you may be able to join in the meal at that time and still have some time before the end of the day to get to sort of know your way around. And as a family, you can stay with the person and you can ask about that and help them to understand what's there, orient to the new environment.
So Elizabeth really talked about, right, again, talking to staff beforehand and tell them about the person living with dementia, right? And on the day of the move, right, bringing the person at a time, right, that works best with the person's habits and their comfort level, and maybe even staying a while to help the person orient and also get settled. So of course, just like how we heard from the video clip, right, it can be especially helpful to inform facility staff about the person who is going to be moving in, right? So one useful tool that can help convey the person's preferences and routines, right, is so we have this personal facts and insights form, which is found on our care finder at alc.org. I'll definitely find that and also send Talia, who can also send it out after the program. You can use that form to really guide a conversation with the staff at the facility, right, about the person with dementia, and then also leave copies with them for others to read as well. So some people with dementia, right, they might adjust to a move quite easily. Maybe they really enjoy the increased opportunities to be with others and really engage socially, right? Others, they might initially retreat, or become more agitated. They might become more confused, right? Still, right, others adjust by trying to regain control or making increased demands, sometimes even on you, right? But of course, we want to try to not take this personally, right? Reassure the person by saying, we'll try to take care of it, or maybe we say, right, we'll see if it's taken care of without making a specific commitment, right? It might take a few months for the person to feel comfortable in their new surrounding, right? Some individuals, they might never come to a peaceful point, right? It's crucial that you realize that you can't make another person happy, right? That's not within your power, right? What's important is, again, that your family member is safe and taken care of, and that their quality of life is going to be the best possible, right? Person's appearance may change compared to how they looked at home, right? And this is very normal, right? You're providing that one-on-one care at home, but this is impossible, right, within the care facility. And what you're seeing is going to be the person's true level of need, right? So really try to look at things through their eyes and just really try to live through their world, right? So for example, the person, maybe they might have been a very sharp dresser, right? The staff might now ask you to maybe bring in, sweatpants and Velcro shoes, right? More of the dementia-friendly clothing, right? And of course, although this is a change, right, it might make it a lot less stressful to the person to get dressed, right, with this new way, right? And then once the move is going to be made, right, it can feel like a relief to you to be able to function, right, as a family member again, rather than a primary person providing the hands-on care, right? Of course, the ability to get more sleep, right? That might sometimes reveal to family members how exhausted they have been, right, while being the main ones to provide that care, right? On the other hand, sometimes it takes time to adjust, again, as a family caregiver, and sometimes they might not feel happier or less stressed after the person is in the facility, right? Your need to advocate for the person, that's not going to change, right? And there might be some need, right, or opportunity to continue helping, right, which might be with some tasks such as feeding or assisting with activities, but still, right, there is that difference between knowing something is right intellectually and also accepting it emotionally too, right? So really trust that you will feel better over time and, find ways to make visiting the person, right, a lot more comfortable for both of you. And so for some families, right, that decision to use a nursing home, right, that brings the opportunity to reconnect, right, because again, you can simply spend time with the person again, right? Still, of course, it can be difficult to visit someone in the late stage of the disease, right? In other cases, right, it might be tempting to spend long hours at the facility, right? But really try to set limits, right, on how long your visits last, right? Take care of yourself, right? You gotta take care of yourself during this time, reach out to family and friends, right, to express the ranges of feelings that you might be experiencing, right, knowing that that wide range of emotions, that is normal, right, that is a-okay. So it is important to monitor the person's care whenever others are involved in that care provision, right, and to really watch for potential changes and problems, right, so that they can be addressed immediately, right? Changes in the person's status, right, that may or may not be related to dementia. So monitoring that care, that's going to involve increased vigilance to, several factors, right? So for instance, right, being alert to the person's changes and maybe the person's general cleanliness, right, that can indicate neglectful or substandard care, right? Related signs of problems with personal care provision that can include those changes in grooming habits, right? Changes in skin condition, right? Maybe there's bruises open or discolored areas, right? That should be noted, right? As that can indicate that carelessness or potentially even abuse, right? Any sudden weight, thirst, breathing, bladder, bowel or behavior changes, that should be reported to a doctor immediately as well, right? That could be signs of conditions that could be treated with maybe medications, right? For example, right, fluid and electrolyte imbalance, right? There could be pneumonia, urinary tract infections, and bed sores, right? Again, we want to make sure if we do notice anything in our visits to this person, right, we want to make sure that we report these to doctor as soon as possible so that they can help in treating these symptoms. Great. So regardless of the setting in which the person is receiving the care, right, that individual with Alzheimer's disease, they should feel that their wishes are still being respected, right, with regards to that legal affairs, right, to the greatest extent possible, right. In general, the law operates in accordance with that ethic, right, and presumes that everyone has the ability to act legally on their own behalf, unless if there are alternate arrangements that are going to be made, right. But again, when someone with Alzheimer's disease or another dementia, right, that decision making does become compromised, right, and they will eventually need someone to step in and then take care of their own legal matters, right. First and foremost, right, those decisions should be made using those legal and financial documents that's already created, right. Again, that includes power of attorney, right? Power of attorney, which can be appointed for that legal and financial matters, as well as also healthcare too, with healthcare proxy, right? All of them require that arrangements do be made in advance of needing them, right? So, those durable power of attorneys, they do differ from basic power of attorney, right? And that the more basic version is no longer usable once the person can no longer make decisions for themselves, right? So making sure that we do have a durable power of attorney, right, established when the person with Alzheimer's disease is in the earlier stages, right, that's when those arrangements can be used, right? Of course, if those advance directives were not created, the person's physician can also work with family members too to make those decisions by drawing upon, right, the family's understanding of previous conversations with the person when they are still able to communicate those future care preferences. If there are no advance directives and family members disagree on decisions that need to be made, right, or if there are no family members, right, that can make these arrangements, right, sometimes there are going to be arrangements for legal guardianship that might be necessary, right? And the law requires that in order for a guardian to be appointed, right, there must be a documentation by a physician, right, of incapacity, right, meaning that the person can no longer make decisions and follow through on them in a way that reflects their best interests, right? And the details of that definition of that incapacity, right, is going to vary from state to state. So definitely look into that, especially because I know that New York City also has different laws from other states too. So guardianship, that's really designed to protect and promote the well-being of an individual, right, whose functional limitations is going to prevent them from making their own decisions, right? And that's going to be needed when the person with dementia is single, right, or when the family cannot agree on a specific plan, right? Making guardianship arrangements, that also requires going to court. So when a guardian is appointed, right, that court is going to give the guardian, right, the authority to exercise certain legal rights in the best interest of the person. And the court will often look into maybe a spouse, a partner, children, family, or friends to act as a surrogate decision maker. But in some cases, right, we do see that guardianship is given to a court-appointed individual, right? That's a completely third-party person, probably has no relations to the family at all, which can include maybe a banker, right, a physician, maybe a different legal guardianship that's just completely unrelated, right? And of course, excuse me, the court, they might also limit, right, the guardianship to only those areas in which the incapacitated person is unable to, excuse me, is unable to make responsible decisions, right? That includes traveling and deciding where to live, right? Refusing or consenting to medical treatment, right? Maybe treatment in a hospital or institution, right? If there's different, financial processes, right? Lending money, paying debts, right? All of those, right, guardianships are powerful legal arrangements that can provide important protections, again, for the person with Alzheimer's disease, right? Of course, when families disagree, right, on the care that's needed, or when someone is trying to take advantage of the person living with dementia, right, guardianships that can provide that well-intentioned family members with the power needed to provide that necessary care and also protection for the person, right? Of course, if you do need help or have concerns about guardianship or other issues, again, it's really important that we do get that legal advice and services from an attorney that specializes in elder law, not just any regular attorney, right? We want to make sure that it is an attorney with elder law practice, right? All right. So we talked a lot about the legal and financials. We want to talk about now about efforts at life extension, right? So it is normal to experience those mixed feelings about whether to agree to those medical efforts that's going to extend the life of a person with dementia, right? And the balance between the quality and quantity of life, that's going to be a very delicate one, right? Then only becomes more complex when the person is in the late stages of dementia, right? Still, though, there are going to be ways to alleviate that suffering for the person with dementia by carefully considering, again, those nutrition issues and also exploring options such as hospice and also palliative care. So, people living with dementia, they might use behaviors to indicate a wish to avoid food, right? Such as turning their head away, maybe they clamp their mouth shut, they push away the person's hand, right? Or maybe spitting out the food, right? And that could be very challenging and also very stressful for the family member, right? If the person is in a long-term care facility or a hospital, right, the staff, they might not have the patience or time necessary to assist the person with dementia with eating, right? So physician, they might recommend that the person be fed with a tube and ask the family guardian, family or guardian, right? In almost all instances, though, however, right, that assisted oral feeding, that may be a better alternative to tube feeding, right? So long-term tube feeding has really no apparent advantages, right? And also has a number of disadvantages, which includes, right, increased risk of diarrhea, increased use of physical restraints, and potentially an increased risk of infections too. So furthermore, the person with dementia, right, is denied the gratification of also tasting preferred foods, and nutritional status usually doesn't improve with the use of tube feeding, right? And of course, with that, right, when we're having these considerations, the individual with power of attorney will need to prove that as well. So towards the end of the late stage, you might want to talk with the physician about hospice, right? Hospice is a service that focuses on providing care and comforts for the person with the disease and the family in the end stage, right? And offers equipment and also medical care for the person with disease, right? And these costs are usually carried by Medicare. Hospice is that unique option for managing care because, again, it could bring care to the person, right, which minimizes that trips to the hospital or the doctor's office too, right? So hospice also places an emphasis on maximizing that patient comfort and also providing the counseling and also bereavement services to the family before and also after the person passes away, right? In order to qualify for hospice benefits under Medicare, a physician, they must diagnose a person with Alzheimer's disease as having less than 6 months to live, right? Hospice care also includes palliative care, right, which seeks to address not only the physical pain, but also emotional, social, and also spiritual pain to really achieve the best possible quality of life, right, for families and also the patients too, right? Whether it is used at the end of life or not, right, the focus of palliative care is not to cure disease, right? Healthcare professionals who specialize in hospice, right, and palliative care, they work closely with staff, family members to address all symptoms of the illness with the aim of providing, that comfort and also dignity too. So hospice care that can be implemented in the home or in a residential facility, right? So really speak with the doctor overseeing the care of the person with dementia to discuss, hospice as a care option too. So often we do hear about people being afraid of, to bringing hospice in near the end of life, right? Fearing that's going to hasten, right, the death, or that indicates a lack of caring about a person continuing to live, right? So just to really debunk those fears, right, we're going to take a look at some of the myths about hospice, right? So myth number one, right, bringing in hospice means giving up on the person, right? No, right? Reality is that actually hospice provides care and comfort for the entire family to help with the end of life once it's inevitable, right? So while hospice care is provided at the end of life, it is by no means, it does not mean, or it's not going to signify that you've given up on the person, right? Giving up implies that there's less care that's going to be provided because there's no hope, right? When we flip that, right, when hospice care is brought in, there's actually more care, right, that's going to be provided because a care plan is going to be developed, right, that focuses on so many different aspects of the person's well-being, in addition to make sure that we're going to treat some symptoms, right, such as emotional care, comfort, pain management, right, spiritual care, and also support for family members and friends. Myth number two, hospice will leave the person I care for drugged and unable to function. The reality to this myth is that hospice will provide palliative care so the person will get what is needed to manage pain, right? Newer medications allow the person to be controlled while not overly sedating the person, right? Hospice agencies, they do have specialized knowledge about end of care life, right? End of life care, sorry, which also again includes that pain management, right? So while it is commonly assumed, right, that all pain medications induce a heavy sedation and increased tolerance, right, there's no science-based evidence that suggests that pain medications lead to addiction, right? So of course, with proper management and administration, those pain medications can provide the comfort and relief while still allowing the person to function within the context of the progression of the disease. Again, just talk about hospice, right? Again, hospice focuses on the quality of life. It's going to provide that comfort, care, and support services for people with terminal illnesses and their families, and it's covered by Medicare. All right. So next, we're going to have Stephanie come back, who's going to talk about describing her experience with this service.
Toward the end, my mother did go into hospice. I must say, I fought my mother's doctor relentlessly. I did not want my mother to go into hospice. I think because psychologically I knew what that really meant. But it was time. It was time. And of course, there's a shift there. We no longer saw the primary care physician. We saw the hospice nurse who came out 3 times a week. And she was on call. So if a regular visit was not scheduled, but I felt she needed to be there, I could call and schedule a visit. I remember her to this day. Her name was Dorothy. And then, of course, the hospice doctor was now responsible for my mother's care. And they were there until the end. They were there until the end.
Just like how Stephanie talked about, right? End of life, caring for someone with Alzheimer's disease, it's a long process, right? That might be accompanied by a series of losses, right? And the end of life for someone that you cared for, that's the time that you can leave those closest to the family with, varying degrees of maybe sadness, exhaustion, or sometimes even relief that the process is over, right? Many people, they express that great deal of guilt, right, over feeling relief about, the end of life for a person with dementia. Some people, they talk about the long goodbye or the person's having lost themselves with the progression of disease. But again, it is possible to have positive end of life experience with someone living with dementia, right? And it involves connecting with the person in a different way than ever before, right? Which is connecting with the person's humanness, and the essence of who the person continues to be right up until the end, right? Some may think of it as a spiritual connection, and it can be a very meaningful way of connecting with someone, right? And their core being through the five senses, right? Again, your presence and the use of touch, right? Making sure that you're still talking with them, sound, feeding them their favorite foods, right? Reading them comforting poems, right? That comfort and connection to you and the person with Alzheimer's in the final, end of life stages, right? That is very important, right? And ultimately, regardless of whether you are able to, right, have an optimal end of life experience with the person, right? There are going to be ways to honor the person's spirit at or after the end of life, right? So really making sure that, again, we're gonna there's a lot of help, right? There's going to be a lot of counseling that could really help and are ready to help, all right, whenever you reach out to them. And of course, right, all these emotions are going to be very valid, right? We are humans. There are so many different emotions that's going to come with it, and making sure that we do take that time to grieve, right? Not bottling up any emotions. That can be very helpful too. All right. With end of life decisions, right, it is again crucial to respect the end of life wishes, right? And the best way to do that is ensuring that those advanced directives are already in place, right? If it was not possible, some decisions about level and also type of care, right, that might need to be made in the moment based on the understanding of the person's wishes as they stated them in the past, all right, in combination with the person's current medical situation. Right. As a general principle, we do want to maintain comfort and connection for the person with dementia, right? So really making sure, again, right, we're going to respect the end of life wishes, ensuring advanced directives are in place, and also maintaining comfort and connection. Right. And grief, right? So when a person with Alzheimer's disease, passes away, it is normal to feel a familiar yet new kind of loss, right? Considering that people who are part of families, right, living with someone living with dementia, they often do experience that anticipatory grief, right, while the person's still alive. Again, it is also normal and it's very common to feel relief, right, that the person's struggles as well as yours have also ended too, right? So just know that you are entitled to all of your emotions, and you may start feeling them in different ways or varying intensities at the end of the person's life. Right, and as this happens, right, you might mourn them, you might experience feelings such as denial, anger, sadness, acceptance, right? And of course, while these feelings are difficult, they are, again, very normal. And everyone grieves differently and at their own pace, right? So if you feel like, your grief is so intense that you feel like your well-being is at risk, 100%, do not hesitate to ask for help from a doctor or from a professional counselor. Right, you can also seek support from the Alzheimer's Association, because we do have mass level clinicians, also social workers, who can pick up the phone anytime, day or night, who can also provide that emotional support as well. All right. So speaking of Alzheimer's Association, we do have a whole lot of resources, right? Just to highlight some of them, we do have our 24/7 helpline. Again, 1-800-272-3900. This is free. We are a nonprofit, so every service is free, right? Again, if you do have any questions about different processes, or again, emotional support, or just very lost, you want to know more about the disease, you can call anytime, 24/7, anywhere in the United States, right, to really get that advice. We also have our website, alc.org, which provides a whole bunch of different resources too, and information about the disease. Alrighty. So just a summary of what we talked about today. We talked about options for care, monitoring care, the legal capacity, right? And also hospice and palliative care and end-of-life issues. And that is the end of today's program. So I know it was a very heavy topic, but very important to really think about, again, especially when we are talking about the late stages. So if you have any questions, feel free to put them in the chat box. And Natalia, do we have someone talk about PSS services?
Yes, we do. So as our attendees are getting their questions written down, would like to invite my coworker Kiara Soto to talk a little bit more about PSS and the services that we provide.
Thank you, Natalia. Good morning, everyone. My name is Kiara Soto. I am the intake care consultant at PSS Circle of Care, and we are a caregivers program that offers free supportive services to caregivers who are caring for a loved one who is chronically ill, suffering from memory loss or dementia. These services include counseling, support groups, educational training, supplemental items, respite care, advocacy, and assistance with long-term care planning. If you would like to find out more about our program, you can give us a call at 866-665-1713, or you can visit our website at pssusa.org. Thank you for your time, and I will be sharing our contact information in the chat box.
Thank you so much, Kiara.